Hi, everyone. June is Men's Health Month, and I thought I would talk about a couple health issues that men can have. So number one, prostatitis. Prostatitis is where bacteria can get into the prostate. And the prostate, if you look at it under a microscope, has all these little pockets within it, like the histology, where the way the cells grow, there's all these little nooks and crannies in the prostate that are perfect, sadly, for harboring bacteria. And so sometimes a man will get a bacteria in the prostate and not even really know it's there, and it can brew and brew. And then eventually the inflammation that causes can be a setup for damaging some of the DNA, and a man can develop prostate cancer later on. So I think it's really important to pay attention to this. So how can you do that? One, if you have any symptoms of discomfort in the prostate, where you just have like a vague discomfort when you're sitting, or you have some difficulty with urination and you're a younger man and it's like not time in life when the prostate will enlarge usually, I would say that would be a good reason to get a blood test and a urine test so that you're looking for a PSA level, making sure it's under 1. And if it's over 1 and you're a young person, there's usually a reason for that. And I would say a brewing bacterial infection is a common reason for that. If you see urine infection with bacteria, it's likely that that was introduced from the prostate, because it's pretty unusual for men to just get bladder infections. They're much more common in women, and it's really about the length of the urethra in the men versus women. So anyway, if you have a bladder infection, think about the prostate. So now if you find that you have prostatitis, what do? So traditionally, you're put on antibiotics, and I'm not against doing that because I think it's so important to eliminate the bacteria if it's there. Because of what I described earlier, the hiding places within the prostate and somewhat poor penetration of antibiotics into the prostate, usually the courses of antibiotic therapy for prostatitis are a little longer than that for just a simple bladder infection. So they can go up to 2 weeks, and in rare circumstances, 4 weeks of antibiotics. Now, is there anything else you can do to augment the effectiveness of that? Make sure you fully eradicate the bacteria so it doesn't just come back and you have to do it again. Well, one of the things we do in my clinic is that we have a Hocket device. And so Hocket is an infrared ozone sauna, and you get in, you close it up to your neck, and it delivers ozone into the chamber. There's also a hose that's where ozone gas is getting delivered through a hose that you can attach to a cup. So it almost looks like a funnel with a narrow end attached to the hose and the slightly wider end where the gas comes out. So a guy can get in the Hocket, lift up his unit there, stick this under the, like right on top of the perineum, which is right below the prostate, and infuse ozone gas into there. That can be very helpful for eradicating the bacteria locally. And you can do that, 2 times a week, let's say, for a couple weeks, and that really can help eradicate things. And then finally, as uncomfortable as it sounds, it's very helpful to consider prostate massage, whether a partner does it for you or you learn how to do it yourself. This is important because it actually can kind of like pump the bacteria out of those hiding places, improve the circulation, improve the blood flow into the prostate, and the penetration of the antibiotics into the tissue itself to fully eradicate that once and for all. And then check your PSA to make sure that it's working. So I think it's important to treat something early in life so it doesn't manifest as a more serious problem later on.